Hi, welcome to the University of Waterloo presentation on the Bachelor of Public Health program. My name is Pamela Hervid, and I'm the undergraduate recruitment coordinator in the Faculty of Health, which means that I'm the main contact for future students interested in our public health program. Okay, so when we're looking at health and Waterloo's approach to it, Waterloo does use the World Health Organization definition of health, that health is more than the absence of illness and injury. It is a state of physical, mental, and social well-being. So our faculty in general works to prevent illness and injury, to promote health and well-being, and to improve the quality of life for individuals and communities. When we look at health and how to improve the health of populations, it does require a comprehensive approach. So we do focus on that in our curriculum at Waterloo. Using the recent and I guess current COVID-19 pandemic, it is important to take a variety of evidence-based approaches. So first, it is important to have people on the front lines, say physicians, paramedics, nurses, etc., who are able to treat disease, as well as people behind the scenes developing pharmaceutical products to treat disease, as well as vaccines to prevent them. So that is an important piece of the puzzle, but it is only one piece. It's also important to prevent people from getting sick in the first place. So that's where things like encouraging hand washing and hand hygiene, social distancing, masking, those types of things can really help from overwhelming our healthcare system. Next, it is important to really look at who is at most at risk and how can we protect those people. So looking at the pandemic, for an example, older adults are more at risk, as well as people who might have compromised immune systems. As well, there's a disturbing trend in people with certain socioeconomic status who are adversely affected more than other groups. So looking at all of those factors and how we can protect the health of everybody in our communities. Finally, whatever approaches we take, it's important that they're evidence-based so we can be sure that what we're doing is actually working. So all of those things are really focused on here at Waterloo. When you're comparing similar programs, a program a lot of students are considering is our Bachelor of Science in Health Sciences or our Bachelor of Public Health. Now, this presentation is all about public health, but I would like to kind of cover a little bit of the difference. So since our Health Sciences program is a Bachelor of Science, students do take courses from our Faculty of Science. So traditional biology and chemistry courses, for example, whereas in public health, they do not take those biology and chemistry courses through the Faculty of Science. There is a biological determinants of health course they take in their first year, as well as some science is kind of worked into some of the health courses, but it is not a Bachelor of Science degree, so it does not have as much of a science focus. Next up, we do have a little bit of a difference in where we focus. So for example, where health sciences looks at affecting change for individuals and communities. Public health is for students who aren't as interested in working on the front lines of healthcare. They want to work behind the scenes. An analogy I like to use is they're not the one administering the vaccines to people, but maybe they're the ones behind the scenes mobilizing the resources to get it out to people who need it, and maybe convincing them to take it up if need be. So those are some of the differences between the program. Okay, in terms of our public health program, we do have really focus on influencing societal change in areas that impact population health. So looking at a wide variety of things beyond just biology that affect health. So social, cultural, political, and geographical, all of those things can make a huge difference. And we help students develop the skills needed to affect these conditions and take action to improve the health of the communities. We also have ways students can add on to their degree. So students in public health can specialize in health research, health informatics, so using information technology and applying it to healthcare systems, gerontology or the study of aging, addiction, mental health, and policy. All of these can be added to your degree and actually show up on your degree that you specialized in this area. As well, or in addition to this, public health students have enough free electives that it's pretty easy to fit in a minor or specialization outside of public health as well. So if you are really interested in French and you want to pursue a French minor, that is something you could fit into your degree requirements as well. All right, you might be wondering, why would I study public health at Waterloo? What does Waterloo have to offer in this field? One thing that we're very proud of is we've been offering this field for a lot longer than many other universities. So we've been offering health majors for over 40 years, almost 50 years, and we've had time to expand and grow. So there's over 30 upper year courses you can choose from in health, depending on your interests and career goals, which is really nice to be able to tailor your degree and upper year experience that way. Waterloo also is a research powerhouse. So if you are interested in getting involved in research, either on a co-op work term or working part-time with a professor or doing an honors thesis even, there are lots of professors actively involved in research who love to work alongside students. We also find that our students do well after they leave our program. So we do track that information. We survey our graduates when they're 1 year out from the program to see what they're studying afterwards or what careers they're doing. And we post that information online. So you're welcome to check that out. To see, but we do find our students are quite successful after graduation. Some of that is attributed to Waterloo's focus on experiential learning or learning by doing. So one way we give students lots of experience and make them marketable after graduation is through offering co-op or EDGE. So I'll talk a little bit more about co-op, but it is available for public health students. If students prefer the traditional 4-year regular stream, they're welcome to pursue that as public health students as well. And they could also, from the regular stream, opt to complete EDGE, which is an experiential learning certificate where they can take professional development courses and articulate to employers how the skills and experiences they've done throughout their 4 years at Waterloo are making them attractive employees or candidates for graduate or professional school. Finally, in addition to these kind of career-focused areas, we also have lots of small tutorials, labs, and classes as students kind of work their way through the upper years of the program. We have small first-year tutorials of 30 students, where students will actually study case studies, participate in debates, really have that smaller class interaction where they're looking at real world health problems and discussing how they could use what they're learning in their bigger lectures to apply it to these individual problems that are current or coming up in the future. So really making sure that what students are learning theoretically in the class is tied into actual scenarios and what they might face in their future careers. All right, a little bit more about the two streams. So when students apply to the program, they can choose to apply to the co-op stream or the regular stream. The regular stream is our 4-year traditional stream where students study from September to April and have their summers off. Students who choose this stream tend to want to graduate sooner and enjoy having the flexibility and continuity in their studies, social life, and living arrangements. Whereas if a student's in co-op, it does add an extra year to the time it takes to complete the degree. It still is 8 full-time term semesters of academic study, alternating between the work terms. But through co-op, students can use our database of jobs to apply to opportunities they're interested in, where they want to go, and they can go to a different employer each time or return to a previous employer. They can try different types of jobs, see what they like, and more importantly, perhaps what they don't like, before they spend many more years pursuing that area only to realize the same thing. So it's a really great way for students to build contacts and experience and really add to their resume. But it is a competitive process. So you're applying to jobs in the database that other students may be applying for. So we do have supports to help students out. We have advisors, we'll critique resumes, we'll do mock interviews with students. And we do have that database of jobs available to help students along the way, but it's ultimately the student's responsibility to put themselves out there and take advantage of those resources. Co-op does also cost an extra fee. Students do not pay tuition when they're on a co-op work term. They only pay tuition for their academic terms, but before each co-op term, there is an additional co-op fee that is paid. It's roughly $700 Canadian per work term, and that helps go towards the cost of the extra supports we have in place to support co-op students through the process. Students in co-op and our faculty tend to make between $8,000 and $13,000 Canadian per work term. So they tend to find that co-op fee, which adds up to about $3,500 in total throughout their time at Waterloo, is not so much a barrier because of the amount they're making on their work terms that can also go towards covering some of the other costs of their education. So this chart here shows you an example of what the study works sequence looks like. So students study from September to April in their first year and then have that first summer off. But after that first summer off, they don't get a full semester off again. So they're either alternating 4 months of study and 4 months of work for the rest of the time. Depending on the employer's start and end dates that they'd like to hire students for, and when classes start and end, there might be 1 or 2 weeks between each semester where a student might have time off, but it's not that 4-month break, other than that break between first and second year. Okay, and this shows Andrea. So Andrea is a public health graduate who did a work term in Singapore. So students can actually pursue co-op work terms abroad if they choose. And she was looking at health behavior economics and helping study the walking behavior of Singaporeans. So it was more of a health promotion focus to see if they can encourage people to walk more and what was effective that way. Her final 2 work terms, she worked in more government public health offices looking at health policies. And so that kind of gave her a really broad perspective of what the health field's all about. Now she's working for a private company that delivers patient software solution to hospitals and other clinical health providers. So kind of interesting how she has kind of gotten all different kinds of experience and transferable skills in the health field. Speaking of careers, you're probably wondering what this program can lead to. So some of our students use it as a stepping stone to healthcare and social services. So working in health promotion, working in research, or looking at, like Andrea, looking at digital health and how to kind of work behind the scenes, but enable smoother processes for those frontline healthcare workers and systems. We also are seeing a lot of students who go into private industry that are delivering healthcare solutions and selling it to these areas. So we'll have students go on and become consultants, analysts, product advisors, because they have the knowledge of the healthcare system, and they also get some expertise in health informatics in our program. So using information technology in healthcare, which aligns well should they want to go into the private sector. We have many students who don't go private sector and who also choose public sector. So working in government and public administration, obviously there's many types of public health jobs in that section as well. So analyzing government policies to see what's the most effective and what should be adopted down the road. Things like vaccine coordinator, which has been a hot role over the last few years in high demand. And then we also get students use this program as a stepping stone to further education. So programs like social work, law, or obviously public health and epidemiology if they're staying on the same path. In terms of admission to this program, we have about an incoming class of about 60 students. If you're from Ontario, I'll read through the Ontario requirements, but if not, you can go to the University of Waterloo admission requirements website and you can pick from the drop-down menu your system of study, and it'll tell you exactly what courses and averages you need from wherever you're studying. But in terms of Ontario students, we'll look for an English course and a math course, and then use that in your next best 4 grade 12 U or M courses to calculate an admissions average. Our overall cutoff is usually in the low 80s for the regular stream and the mid 80s for co-op. If you're not sure which stream you're thinking about, or you're interested in co-op, but you're not quite sure if you'll meet the cutoff, by applying to co-op, you'll automatically be considered for an alternate offer to the regular stream. So you don't need to apply to both. We also have an admission information form where you can tell us about yourself outside of the classroom. That is optional, but we suggest filling it out because we can use it in some scholarship decisions. All right, if you'd like to find out more, we have a contact information there. That email address and extension goes to me, so I'd love to connect with you in the future should you have further questions or any questions. We also have events throughout the year. We have a fall and March open house happening, and those will be listed on our website as the date gets close, as well as in-person and virtual tours. Finally, we have the opportunity for future students to connect with current students. You can fill out a form and we'll connect you if you'd like to learn more about what the student experience is actually like. So I hope this information has been helpful for you. I wish you all the best as you explore options for continuing your education. And I hope maybe I'll see you on Waterloo's campus someday.